Good day to all. We are coming to you live from the studios of the Government Information Service via the National Television Network to provide you with an update on the reopening of school for grade 6 and Form 5 students. I am your moderator, Claudia Monlouis. We are also live on the Government of Saint Lucia Facebook page and the YouTube page and via the various private media houses. So once again, welcome to viewing. The Ministry of Education has recently announced the consideration of the reopening of school, albeit for Form 5 students and grade 6 students, not all students, and here to discuss the implications of all of the factors which have been considered in the context of the COVID-19 protocols which are still in place and to introduce the panel, we have at the moment the Chief Medical Officer, Dr. Sharon Belma George. We have also Chief Education Officer, Dr. Fiona Phillips Meyer, and we have Coordinator, Guidance and Counseling, Ms. Joycelyn Eugene, and we will be joined later by the Registrar of Examination, Carmelita Matthew. First of all, to get an update on the overall decision to reopen, I would like to call on the Chief Medical Officer, Dr. Sharon Belma George.
Good morning, thank you. Our Chief Education Officer, Dr. Fiona Meyer, the Registrar of Exams, Ms. Carmelita Matthew, and also the Coordinator for Guidance Counseling, Ms. Joycelyn Eugene. Thank you so much for inviting me to join you this morning. In an effort to respond and to prepare for COVID-19, Saint Lucia implemented a number of control measures. Some of these measures included movement restrictions, the closure of businesses, travel restrictions, the 24-hour shutdown, the institution of curfews, and from very early, the closure of schools. Saint Lucia, like many other countries in the region, has demonstrated that COVID-19 transmission can be slowed down and stopped. And you will note from this graph that Saint Lucia has the lowest incidence for COVID-19 in comparison to Barbados and the Eastern Caribbean countries. To date, we have recorded a total of 18 cases, all of which have fully recovered. The last case was diagnosed over 19 days ago. And this is just to give you an updated summary of our situation update. The total number of tests done, 867. Our confirmed cases, 18, like I said before, and all of them have recovered. And cumulatively, we've seen and managed over 900 persons, both in quarantine and isolation. We'll also give you an idea of the epicurve for Saint Lucia so you can relate to where we are in relation to COVID-19 and the epidemic. You will notice our curve. We saw the increase in cases. And if you look to the month of May, we are now in the 3rd week of May. You'll notice that there's just a gap. There's been no cases, and we have been testing within the communities, and all of the results have been coming out negative. With our cases, we've also increased our level of testing to ensure that there were no cases within the various communities, and this is going to continue as we move forward. So as you noted, as you can see by the graph, our cases have reduced, and if you look through the month, through May, for our epi weeks, you will notice that this part is completely flat, and we have been testing. As countries manage to maintain low level of transmission of COVID-19, a national risk assessment is done to balance the risk of relaxing measures, the capacity to detect, to test, to isolate, and to treat cases efficiently. The risk assessment is based on epidemiological factors, healthcare capacities, and the availability of effective treatments. The adjusting of measures have to be done in a controlled, slow, and stepwise manner. As the measures are lifted, the strengthening of public health and social measures being implemented is necessary. It is estimated that COVID-19 will be here with us for over 2 years. The education sector, in a similar way like every other sector, needs to implement protocols to ensure safe instruction of our students. In reality, is the option of keeping schools closed for 2 years. We understand the panic and the fear related to COVID-19, and this is also justified given the pandemic in the developed world. But we cannot act out of fear. We need to use the assessment of our local situation and ensure the necessary measures are in place to move forward. Over the last few months, the Ministry of Education and Culture has been working closely with the Ministry of Health and Wellness in making decisions in relation to classes for 2 critical groups, the grade 6 students and the Form 5 students. The risk-based assessments includes the current understanding about COVID-19 transmission in children. The data indicates mild disease in kids. The local situation and the epidemiology of COVID-19, the school setting, and the ability to maintain COVID-19 prevention and control measures. Additional factors must also be considered, including the harm that may occur to school closure, the risk of non-return to school, the widening disparity in educational attainment, limited access to meals, the need to maintain schools at least partially open for children whose caregivers are essential workers. Our national situation in relation to COVID-19 has been explained. Based on the gains from an empirical standpoint, schools can be given the green light to open up completely. Out of abundance of caution, it is recommended to keep the general school population closed with the online model and to concentrate only on these 2 critical groups due to their pending examinations. According to the World Health Organization, there have been few COVID-19 outbreaks in schools. From the studies conducted, the transmission was primarily related to the social events linked to schools rather than transmission within classrooms. The Ministry of Health and Wellness, through the use of scientific, evidence-based, and using the epidemiological analysis on our national situation, will continue working closely with the Ministry of Education as we transition through a phased, priority-based plan to ensure safe educational environment to all of our students, the staff, and the management of these institutions. Thank you.
Thank you very much, CMO. And from your words, we are certainly reassured that safe instruction remains paramount. Although there are many issues in the mixed bag of COVID-19, health, public health, health among the school community remains the overarching concern. And to elaborate on this, I would like to call on the coordinator for guidance and counseling, Joycelyn Eugene. Welcome once again, and tell us how guidance and counseling factors into this discussion regarding the reopening of school for grade 6 and Form 5 students.
Thank you. Good morning. The impact of COVID-19 globally is tremendous. And of course, there is a major impact on our children. We are in a heightened state of fear and anxiety in a lot of instances, but children are resilient, and they usually fare better when their caregivers are doing well. As we go into the aspect of the reopening of school, I want to look at this as bridging the gap. There's a gap that is being created for students and teachers as a result of COVID-19. Referring to this picture that I have here on the slide, grade 6, CSEC, and CAPE students, throughout the last 5 years of schooling, have been pushed towards a particular end. They have been told that they get to this transition point, which will move them over into some aspect of their future. And COVID-19 really, broke the bridge. And it became unclear for the children to see how we could move through that, even for the teachers and those of us who have been, all of us who have been experiencing various levels of stress and frustration and all of the other feelings as we go through COVID-19. But as educators, we are trying to bridge this gap for the students so that they will be able to transition. All stakeholders have a responsibility to help close that gap, and by taking the steps to stabilize the environment for the students. So the parents, teachers, principals, health officials, all of us are together working on how best we can move our students so that their psychosocial development would not be impaired, and that they would, they would be able to get some encouragement and stability in this uncertain time. We are crossing over into what we refer to as a new normal. We have no blueprint. We have no prior experience. We really don't know how to do this. And when I looked at this picture, I saw it as us building that bridge while we cross. So as we go, we are listening to what the health officials are saying. Based on what we know children need, and from a counseling perspective, we are encouraging that the steps would be taken so that students can get to that place where they can transition efficiently. One of the things we want to ensure is that we want to secure the students' future from now. If we do not help them transition efficiently and effectively now, 5 years from now, they will be dealing with the repercussions. And anytime a child is not supported and does not get through trauma successfully, anytime they face something that looks similar in the next few years, if they face another crisis, they will revert to the same type of behavior that they had, and sometimes it goes right down to apathy and inability to be able to move forward. So in order for us to help them develop the skills necessary, we want to ensure that we do all that is necessary to help those students and to bridge the gap. Secondly, I just want to touch quickly on the district and school counselor responses. We have determined that psychological first aid for the teachers, those specific teachers who will be going into the classrooms and who will be meeting the students, psychological first aid through the support of the school counselors, the district counselors, and counselors within the Department of Health would be provided so as to assist those teachers in terms of calming some of their concerns and fears going into the classroom. This is one of the aspects of our response. For the students, we have what is referred to as a Return to Happiness program that is usually done, around in various countries when we respond to crisis. But the district and school counselors will be using some activities with the children in order to assist them and to find out how they're coping throughout all of the COVID pandemic, the lockdown, etc. Secondary school counselors will continue to work with their students who are the CSEC students who must transition to college or their workplace. So what we are doing is providing the virtual support, and in instances where necessary, the face-to-face support so that students can complete their online applications and, of course, make that transition step. Services that will be provided are going to be done both virtually and face-to-face as safe as possible. And so all of the protocols that have been established, all of the guidance and guidelines that we have been given by the Department of Health will be followed, as well as we seek to support the students, bridge the gap, help them transition successfully despite the uncertainty of COVID. Thank you.
Thank you, Ms. Eugene. Just a reminder to members of the media as well as the general public, questions for our panel can be posted on the Government of St. Lucia Facebook page and the YouTube channel. As indicated by the Chief Medical Officer, school has been closed for a while now, The date, to be exact, March 16th, 2020. And I would now like to invite our Chief Education Officer, Dr. Fiona Phillips-Meyer, to tell us more about the process leading to 16 days of school for Form 5 and Grade 6 students.
Thank you. Thank you so very much. I so appreciate the opportunity to be able to speak to members of the general public. I wish to recognize and show sincere appreciation for the Ministry of Health, and in particular, our Chief Medical Officer, Dr. Sharon Belma-George, members of our team at the Ministry of Education, as well as our district education officers and our principals, teachers out there, the parental bodies that we've been able to interact with. Good morning to everyone. My responsibility is really to speak from the education standpoint. And I would like to begin by recognizing that this is a phased, proposed, safe reopening of schools. One of the most important elements for us has been the collaboration with the Ministry of Health and our Chief Medical Officer. So for all of the guidance, the advice that we have sought it directly from them in terms of the scientific information and data to guide all of the pronouncements that we continue to make. We have, as a team, over the last 2-3 weeks, engaged major stakeholders. Those have included our Saint Lucia Teachers Union on 2 occasions, one of which we had the CMO and her team with us, our National Principals Association, the Secondary School Principals Association, other administrators, secondary school and primary school principals. We've engaged parents, we've engaged students, because it has been very, very important to us that we get stakeholder engagement. From the onset, the reconsideration of our locally based examination, that being the MST for our grade 2 and 4 had been cancelled, so all of our parents are keenly aware of that. We have worked collaboratively with other members of the regional team, and you would note that the CSEC pronouncements have come from a regional position. In all of this, the health and safety protocols remain at the heart of everything we do, because we want to make sure that our students, our staff, all of our stakeholders are at the best place that they can possibly be at. The sanitization of our schools has continued with our cleaning staff, our support staff, coming to school throughout this period twice a week. And we will move to increasing that significantly as we look at the group that is coming back. We understand and we appreciate, and that's why we've engaged our various stakeholders to look at some of the perceived limitations. One of the major ones being anxiety. And so this is why we've continued to engage our Chief Medical Officer to give us the scientific information. Concerns reference students with various health issues. And we would hear our parents speaking of asthmatic children. And we recognize this, we appreciate this, and we continue to say liaise with the health professionals in terms of decision making. Because all of our children, all of our staff are important to us. Their health and well-being will never be compromised. We continue to look at counseling. We're very glad that our head counselor, our counseling team have put the blueprint together. They have put the roadmap together as to how best to support our students. I mentioned the cleanliness of schools. That is being done in a very systematic and strategic manner. Of late, we've heard of the water woes of Saint Lucia, and so a deliberate effort has been made to find out from every district, from every school, in terms of water issues that they may have. And I know that my health and safety officer is putting together all of the bits of information in order to mitigate any risk that may occur based on limited water resource. We appreciate the protocol for the use of masks, and some of our parents have a very genuine question and concern how long will my child have to keep the mask on? And so there are specific protocols for the use of mask as well. What is our strategy? Now we speak of the plan. The plan has always been one that is all-encompassing. What we have attempted to do over the last 3 weeks is to engage stakeholders, because the plan has been, continued to be informed by their engagement on the ground with us. And so we appreciate that engagement. And this morning we are told that based on the risk, Saint Lucia can really open up its entire education system. I know that may be music to the ears of many of our parents, but because of the timing, the Department of Education has looked specifically at a phased approach. So, every school, we have 74 primary schools. Our infant schools will not be impacted, but our primary and combined schools will be. That includes our private schools as well as our secondary schools. So we will have, and they've already started coming in terms of an individual school instructional plan for this short period of time. It starts on June 2nd, because June 1st is a holiday, and we will end around the 29th where the examinations will happen. Because we appreciate that schools are different. A school with 120 grade 6 students is a different environment to a school with 20 grade 6 students. And so there will be an individual plan based on each of those schools, similarly for our secondary schools. We spoke of some of the issues for our parents and making sure that we get the names of vulnerable students for our school feeding, our transportation subsidy, the use of our mask. All of those bits of information have been collected to ensure that any needs that we have out there, we do our utmost to ensure that our students get the best possible reintegration into the school. We have not left out our teachers, and we continue to say that teacher voice is important in the implementation of this program moving forward. Our counseling services continue to be available to all of us. I'd like to give you a bit of information as to the number of students that we're looking at. And you heard Mrs. Eugene speak about bridging that gap. Sometimes I think, do we crawl over it? Do we walk over it? Do we hand hold over it? But where are we trying to get to? And where we're trying to get to is to see that our 2,444 students who are registered to do CSEC examinations, who started this year thinking that they would end in that manner, actually get that opportunity to do so. Our 492 CAPE students. For CCSLC, we have 113 students. For our common entrance, our grade 6 students, we have 2,198 of them in our primary schools. How can we ensure, within a safe environment, following the scientific information given to us, that we provide the best possible end of this academic year to our students? This is our goal. This is our objective, and we hope that our various stakeholders appreciate this is what we're trying to do in terms of bridging that gap. We've had quite a few strengths during this period, including improving our e-learning strategies. We also recognize that there is inequality of access among our families. That is the reality among our various families, that not everybody is on a level playing field. And so giving our students an opportunity to actually come back and get the same kind of service across the board would hopefully decrease that inequality. There is need for improved training within our virtual and online teaching, and we have continued to do so. Mrs. Eugene also spoke to the Return to Happiness program, the psychosocial interventions that we've already started working on. But most importantly, I appreciate that this has been a traumatic time for our students, but the resilience of our staff, our students, our parents, and our wider community speaks to who we are as a nation and who we are as a Department of Education working in collaboration, respectfully, with all of our stakeholders. And so, we know our parents are concerned about the precautionary measures. The protocols have been shared, they continue to be shared under the guidance and advice of the Ministry of Health. Some of the basic ones moving into this new period for our students include, they're not limited to, but include social distancing, reference to the use of the desk space, the consistent use of masks, proper hand washing hygiene, and we can't hear it enough that soap and water is the best thing to use. Simply wash our hands as a very significant part of ensuring that we mitigate risk in light of COVID-19, and that some of our students with respiratory issues should remain at home unless if this is authorized by a medical professional. So we kindly say to our parents who are concerned about their asthmatic children, we recognize your issue, we appreciate that this is significant to you. We ask you to seek the intervention of medical professionals, and by so doing you are better able and better informed to make a decision. And kindly communicate that with us so we are aware. Reference our common entrance. What does it look like in terms of a very practical implementation? And it is that we're going to have a multiple choice paper, which is the same as a regular multiple choice. And the reason for choosing the multiple choice paper is that we lessen all of the handling of hard copies of the document. So this document and this examination will be marked electronically. It will include all the components: the mathematics, the English, the social studies, the science and technology, health and family life, as well as the study skills. So that will happen on June 29th, which is a Monday, for all of our 2,198 students in the common entrance period. What does CSEC look like? CSEC will be held in July based on a regional position where up to 14 ministers of government voted for that regional position. That was the COSOD meeting held about 2 weeks ago, chaired by the Minister of Education of Antigua and Barbuda, Mr. Brown, and in attendance were ministers throughout the Caribbean. It is a modified version. It includes the multiple choice questions as well as school-based assessment. The modality will be both e-testing and paper-based, so as a nation we can identify what our preference is, and both of those modalities will be facilitated by CXC. We note that we've been doing e-testing for a while now for many of our subjects that have smaller groupings. So e-testing is nothing new to us. It has been around for several years. Matriculation, the UWI has been really great about speaking and putting a proposal together for the students who leave our secondary schools as well as our Cape students into University of the West Indies. So you're looking at at least 2 first units, looking at grades 1 to 4, and the information from the other units. Our associate degree students, likewise, they are being considered, and the GPA will be used to help them move into higher education, and that includes their coursework as well. I would really like to let the general public, our parental bodies, know that every child, every staff member is important. And it doesn't matter to us, our caretakers, our support staff, our administrators, our teachers, they're all significant. And this is why we continue, and we have continued, to engage the Ministry of Health every step of the way so that they, in their expert capacity and being the medical professionals, can guide us. So the well-being of all of our people remains significant. We note that some of our students are higher risk. Even without COVID, they may have had underlying issues. That goes for our staff and for our students, and so that has been taken into consideration. And in liaising with our principals, we continue to say, let us document any need we have along. And we continue to appreciate that stakeholder engagement is core to everything that we do. We'd like to end by really noting that in every human experience, including COVID, we learn to become resilient, we learn to build bridges, we learn to look at the scientific and expert advice that is here right with us in Saint Lucia. It's nowhere else. But it is based on those that we continue to forge ahead, we continue to propose the safe reopening in collaboration with the Chief Medical Officer, and our parents have spoken to us about what could the triggers be that could cause us to abort the plan. The triggers would be any guidance and advice that we get from the Ministry of Health. This is why we continue to say these are proposed plans, but we know and we appreciate that many of our children are impacted. Many of our families are impacted. And because of the inequality in our nation, which is the reality, some of our students have not been able to access as best as others the virtual learning. And so we provide to every one of them that face-to-face, which is sanctioned by the Ministry of Health. I so thank you for your engagement with us this morning, and note that we're available to answer any questions that you may have, and similarly at the Department of Education we remain available to our various stakeholders. Thank you.
Thank you very much, Dr. Meyer. And I would like to call on now the Registrar of Examination, Carmelita Matthew, who also has a statement to share with us.
Okay, thank you for inviting me to this press briefing. We are going to administer the common entrance examination, as the CEO mentioned, on the 29th of June. This is the plan. And the common entrance examination has already been modified to ensure that the content there is based on students, the content area which was supposed to be covered from grade 5 up until the first term of grade 6. So students will be tested on these content areas alone. We have a total of 2,198 students who will be writing this examination, and all our secondary schools will be used during this administration period, on that administration day. The exam will be from 8:30 to 12:50 p.m. It's only the multiple choice paper, which comprises the mathematics paper with 50 items, English language with 60 items, the general paper with 4 components, which is social studies, 15 items, science and technology, 15 items, health and family life, 10 items, and study skills, 10 items, which brings it to a total of 50 items. So all of these will be in the multiple choice format as indicated, and this is what students will be tested on that day. All the protocols for the administration of this examination will be fed from the protocols already established by the Ministry of Education, guided by the Ministry of Health from the CMO's office. So our administration guidelines will definitely reflect most of these guidelines wherever it pertains to the administration of this examination. In relation to our CXC examinations, we have CAPE and CSEC all beginning on the 29th of June and ends on the 17th of July. Then the CCSLC starts on the 20th of July and ends on the 22nd of July. In these examinations, for CSEC, the multiple choice examination paper will be administered. For the modern language CSEC subjects, papers 1, 2, and 3 will be administered, whereas for the CAPE modern languages, papers 1, 2, 3, and 4 will be administered. Human and social biology will have 2 papers, the paper 1 and the paper 2. For the visual arts, students will only be required to submit the SBAs and the reflective journal. So these are the components of the examination which will be administered to students for CSEC, CAPE, and CCSLC. As for CCSLC, the mode of the presentation for the examination did not change. So it is the same multiple choice paper and the SBA component for CCSLC.
Okay, our questions have begun flowing in via our online platform. And one which has come in, I think, would be best responded to by CMO. And the question is, are daily temperature checks going to be provided for students, and will social distancing be policed?
The social distancing measures, some of them that will be at the schools will be the students ensuring that they use the same desk when they come in. There are also recommendations for the cancellation of assemblies and different activities that require that a lot of students be in one area. So the after-school activities would also have to be cancelled as per our recommendations, and that the students' desk, the placement of the desks in the classroom, so it won't be the regular 30 students per classroom, but a lot less to ensure the 6 feet distance that we recommend. And avoiding as much as possible the handshakes and all of what the students usually like. And if you note that it'll be a reduced time for the school day, to reduce the lunch hour when the children tend to gang up and socialize, because from the documents that we have reviewed, transmission occurs more when there are these social activities, when they're allowed to have a lot of time. So that would also reduce it. Also, our regional health nurses will be supporting the school so that if there are any issues, to be able to support that. And there's also a recommendation where children with any respiratory signs and symptoms, they would have to notify the principal, and so that we can be notified as the Ministry of Health, so that we can manage, but those kids would not be allowed to come into school.
And also cleaning agents and disinfectants will be provided. And so the ancillary staff who undertake that responsibility will be doing that in a very concerted way, and certainly more frequently. Dr. Meyer, can you speak to provisions made for vulnerable students? And there's the needling question. I think we could tie into that as to who will provide the face masks for the students.
The face mask discussion has continued to dominate. We appreciate that parents could send in their individual school face mask. We note that the students will be in full school uniform, and so it is important to have face masks. Obviously for us, we know that it's a given that, you know, the kind of information written on those face masks actually reflect being in a school environment. So our first pronouncement is to say that for every parent who can afford to send their own face mask and feels better in terms of hygiene as well, and maybe even to have a second one in a Ziploc bag if the parent can afford to do that, should do that. But similarly, we are going to supplement. We have supplemented the schools. At the moment, every school has a certain number of face masks, but we are providing and procuring additional face masks per school, so that when those are needed, they can be made available. But we would appreciate that the children would be coming in with a face mask, and so it is not when they get to the school that they would be given one. But every effort is being made to provide those to the students and staff as well.
Thank you so much. Another question coming in, what about canteens and vendors? Will they be operating?
Based on the protocols that we received from the Ministry of Health, canteen and vending services have been suspended during this period of time. Our times, it is about 4 hours per day. We've encouraged our parents to be partners with us and to ensure that the students come in with a warm meal, having had a good breakfast, hopefully. But we appreciate that some persons, it is a difficulty. And so we would continue to look at our vulnerable students and provide packaged food items to those students on the information provided through the school. So every school is meant to give us a list of students who would have been on the feeding program, who still need that service, as well as students who may need transportation subsidized in every district, and that information is being collected as we speak.
Thank you so much. Speaking of the face masks, CEO, and today we have our CMO and CEO on board. I have to be very careful that I don't get tongue-tied here. You spoke about the face masks, and of course, quite a bit of fashion statements are beginning to evolve where these are concerned. Are we issuing a guidance here for the students and the parents as well? Because as you said, not everything on it. So it will be accepted. So there will be a level of vigilance in regard to that. And anything else, because a previous individual wrote in as to whether the process would have to be policed. It's a school, and some school rules, well, I guess school rules are not entirely set aside now.
Well, let us say it like this. Every principal is charged with the effective and efficient management of the plant. We will make, and we have made, recommendations, but in terms of policing, I'm really hoping that our parents see themselves as partners in this, because the child would have had to left home with a mask on, that our parents and adults can appreciate that the child is wearing his or her school uniform and so should be dressed appropriately. But similarly, our principals are charged, and the school rules remain the same. The school rules have not changed. We're coming back for a period of less than 16 days to ensure that we bridge that gap. But our students likewise, our secondary and our grade 6 students, and I always like to appreciate that they're smart children. With 10, 11, and 12, our children know what's appropriate and what's not appropriate. In terms of policing and reminding, obviously that will be done, but we really appreciate the sense of responsibility that every individual parent, teacher, student must take for his or her own welfare, and in particular reference to the use of masks, that they know that they're coming to a school environment, a professional environment, and so they dress accordingly.
Very well. And in regard to the regular hand washing and use of maybe an alcohol-based hand sanitizer, CMO. I recall a parent indicating to me that she had given her son a bottle of hand sanitizer, brand new of course, and by the end of the day there was nothing left in there. So we can well imagine that the younger ones, would have a different approach to having things like that on hand. So how do you recommend that it is managed, especially in regard to parents who might want to, for the child's well-being, give him or her own supply, and some of them, they come with particular risks. I think the Alcosan comes with some particular risk as well, and so on.
I think the first recommendation would have to be, and I would assume that the Ministry of Education has already done that, to ensure that the parents give the children hand sanitizers to come to school. It would also be expected that the school keep a supply. I just want to remind the public of an important public-private partnership which was spearheaded by Dr. Tanya Bobre with NatMed for the provision of hand sanitizers to every single school. I've been given the assurance that they are putting the arrangements together so that by next week, this will be distributed to the various schools to ensure that before the start of the school term, that supply of hand sanitizers would be available to supplement what the parents give. And just in case, we know sometimes we have children who may not have, to ensure that this is available at the various schools.
Okay, so just to reiterate, the students will not be sent back home because they do not have masks, nor will they be sent back home because they do not have hand sanitizers, etc. The school is keeping a supply of its own, and they will definitely reach out to the students who do not have, to ensure that they have access to it on the school plant. I want to direct a question to our Registrar of Examination. Sir Arthur Lewis has indicated that they are going to have a school entrance examination. Are you aware of that? Can you speak to that?
No, that is, Sir Arthur, it's not part of the CXC program, so I would not know about this.
Okay, all right. Well, there are some concerns about that, but certainly this question can be redirected for more clarification to Sir Arthur. But it's
the Registrar of SAF as well, Ms. Josie, may be in a better position through the office of the Principal Dr. Nurse as well as Mrs. Fannis.
Excellent. Anyway, the concern is out there, as well. We want to look at going forward, Dr. Meyer, the ultimate plan for the reopening of school. Anything in place as yet?
Yes, the plans have been in place for a while now. We have issued a memo to our principals, all of them, yesterday. We've put in the checklist based on the Ministry of Health. We have started distribution of cleaning agents in addition to what they may have had when school closed in March. But for every school, and I was glad when I was in a meeting yesterday with both my secondary and primary school principals, that one of the principals noted that he had already gotten his supplies as of yesterday. So we started with District 5, and our team under Stores and Supplies are really moving feverishly to supplement, to add to whatever we had when we closed, to make sure that we have our protocols in place for the cleaning. As I said earlier, during this time that we were closed, we've had our cleaning and our support staff cleaning the schools twice a week. So we're going to significantly improve that. And for some of our parents out there, it's important to note all of the surface cleaning, the desks, the doorknobs on entry at school, how do we ensure? So all of these protocols are already in place in conjunction with our health and safety officer, also guided by the Ministry of Health.
Another question coming in concerns the protocol for children using public transportation. So I suppose CMO can weigh in as well as you, Dr. Meyer.
We have sought through our principals and district education officers a list of students who may need the transportation subsidized. The general public would be aware that the Ministry of Education, Department of Education, has had students getting transportation now for many years. We note that this subsidy is still available to us, but we're targeting our needy students, and based on the list that we receive from individual schools, parents will be notified. We also appreciate that a school with 12 children who live in the same community would have very different needs to another school with 120 students who live in various parts. So it is really based on an individual school plan. It is based on the submissions that we receive from the principals, through the DEOs, that the transportation pronouncements will be made and the protocols put in place. We note also that the Ministry of Health, through the office of the CMO, have already spoken to the protocols for public buses. And as Saint Lucia moves into the continuous reopening, some of those services are available to our general public, our staff, as well as our student body.
Okay. Can I go further to ask you to make a submission in Creole so that all sections of our community can understand the level of preparedness which is being put in place for the reopening of classes for the Form 5s and Grade 6s.
Okay. Pour toutes ces gens qui écoutent nous, qui regardent nous bon matin, ça nous veut dire c'est toute maman. Pas ni yon nous veut quitter pour yo pas joindre plus meilleur service yo ça joindre. Nous apprécions tant ça là ça en difficulté pour tout le monde. Et difficulté pour grand monde passer pour ti maman. Mais ça nous ka try faire actuellement, nous savons ni maman pour l'année ça là, yo te kay fini l'école. C'est l'école jeune maman, yo te kay fini primary, yo te kay fini l'école ça là, comme l'école secondaire. Yo te kay fini form 5 aussi. Avec nous, j'ai parlé avec Madame CMO, Dr. Sharon Belma George, et puis j'ai dit nous, tant ça là, c'est un temps nous plus meilleur et possible pour nous apporter ces mamans là via l'école. Si nous regardons ces mamans ça, nous pas regarder toute maman, nous pas regarder plus petit juste grand maman, mais nous regarder grade 6 maman là qui a fait examen avec aussi maman là qui en form 5 qui a fini quitter secondaire pour aller se affaire pour aller l'autre différentes places. Là tu as aller ces jours. So nous apprécier ça. Mais nous voulons dire tout parents, tout le monde qui a écouté nous pas faire rien pour principalement nous et mettre en pire situation qui dangereux. Nous voulons continuellement parler avec ces gens qui a gardé santé avec tout ça yo dit nous guider passer pour ça yo ka dit nous. So nous ka garder nous ka dire continuellement parler avec nous, mais nous ka garder pour nous recommencer toute l'école pour ce moment ça là grade 6 seulement avec form 5 nous ka garder les deuxième gens qui ka venir 2nd of June nous ka garder pour nous porter ce moment ça tout because nous apprécier en compagnie moun ni computer l'autre moun pas ni la ni compagnie maman qui était ça continuer puis c'est teacher l'autre maman yo tout partout mais nous voulons dire l'école là c'est un côté yo tout ça oui yo tout ça joindre primaire instruit nous ça ba yo avec ce teacher nous travaille puis c'est l'autre maîtresse l'école pour garder qui manière nous ça aider yo moi voulais parler about maman qui besoin transport pour venir à l'école, maman qui besoin manger, nous savons ça c'est une situation qui est grave pour un chai parent. En dit dans l'école là, nous avons demandé toutes ces gens à l'école là, nous avons demandé pour nous en liste, nous non ce maman là qui besoin avec là nous joindre ces liste nous ça parler pour dire comment nous ça aider. Mais nous pas jamais voulu assise avec pas apprécier la ni différents monde qui ka really ni own toi kayo. Mais toute manière nous ça aider nous kay essayer pour aider. Merci.
If I coco, I'm going to makai essayer Timoso Creole aussi. Encore CEO et so ça expliquer comme que c'est pas l'école pour tout le monde, c'est pas l'école pour preschool, kindergarten. Petit maman comme ça, c'est pas même l'école pour tout le monde, c'est l'école secondaire, c'est seulement grade 6 et form 5. Est-ce qu'on est pour mener rien qui neuf acheter, via acheter livre comme ça?
Non. Nous pas voulons acheter rien, nous voulons venir pour nous ça aider yo primaire qui possible, c'est ça nous voulons. Nous apprécions aussi si moi assise bon nous aujourd'hui à moi tant toutes les côtés ça ouvert moi ça c'est parents qui tennent ça qui ka travail qui des fois bail yo te kay vle ça aussi mais actuellement nous ka garder seulement c'est maman ça là n'importe l'autre maman qui vient dans l'école c'est toujours nous ka espérer pour si moi guider nous à sous comment on pour faire ça nous voulons répéter. C'est pas kindergarten, c'est pas grade 1, c'est seulement c'est maman grade 6. Nous savons, we have 2,198, how do we say that in Creole? I'm not sure. 2,100,000 plusieurs mamans qui kay vini à l'école. Somebody else tell me how to say 98 in the general public. So it is to say, c'est maman ça là c'est yo qui ka vier l'école. Même comme ça, c'est form 5 nous aussi 2,400 mamans. So c'est maman ça nous ka garder pour yo venir l'école, mais nous savons là des parents doa là qui ka dit moi vle ichmo aller l'école parce que moi ka travail, moi des fois bagay pour faire, ichmo pas ka joindre tout instruit ça joindre, mais moi ka aussi demander nous c'est parents pour dire un petit patience avec nous, avec toute information nous hen from CMOA, nous ka travailler sur ça pour nous aider ces mamans là.
Ben merci appel CEO. I don't know if there's anybody else at the head table who wants to follow in suit.
Do we have any questions?
But certainly we invite the other members of the panel, of CEO and Ms. Matthew, to make some closing remarks. We can begin with you, CMO.
Yes, I just want to indicate that the Ministry of Health and Wellness, we have been working closely with the Ministry of Education in the implementation of this phased approach. And as I indicated earlier, we continue working, monitoring the situation for COVID-19 here in Saint Lucia. I understand the level of fear and panic in the general public, and as a parent myself, the most important job that I've been given is to raise my kids. So whatever recommendations, we definitely have them in mind. So the information, health and safety has always been paramount for us and my entire team at the Ministry of Health. As you note, the first organization that we closed was the schools. But at this juncture, as we look at recovery of Saint Lucia, we look at recovery of the other sectors, And also noting that COVID-19 is here to stay. We have to ensure that we live safely with it. So we're working closely with the Ministry of Education to ensure that whatever measures are put in place, our children, the teachers, and the rest of the officers at the institution are given priority. So now we need to look at the safe ways of ensuring that the kids can get an education. At this point, we are only looking at grade 6 and the Form 5s. After we were able to get through this point, we will then look at how we manage for the rest of the school population. And that being said, although we note that for the last, I think, 19 days, we've not had cases, if cases do come, we are prepared to manage, and we will also be increasing our surveillance at the level of the school. So our health teams in the various districts will be working with the schools as well to monitor this.
Okay.
Yes, the assessment unit, we're working to ensure that the administration of all the examinations, this includes the CXC examinations as well as the common entrance examinations, that these are administered within the protocols established by the Ministry of Health for guidance for us. So we're going to ensure that these are maintained at the centers during the administration of exams.
And our CEO, we will conclude with you.
Let me say in conclusion that the needs of our children, the needs of our nation, is not based on one set of individuals. It is really based on the need to bridge that gap. And as soon as Mrs. Eugene said it, it stuck in my head. Our parents, our guardians, your partners, we want you to work with us. Our teachers, I know that our teachers are keen to wrap up this year with their students. They've worked really hard at that. Our principals, we've spoken to both sets of principals, our primary and secondary school principals. The general consensus is that let us make this happen within a safe environment where the resources needed are also provided to them. And as a department, we pledge that. We will also say that nothing is perfect in this world and that those challenges will continue, but that if we continue to effectively communicate our challenges, continue to look within for expert advice, we continue to engage each other. And really important to me is the need for positive interaction. The need to look at relevant sources of information that speak to information that is genuine, information that comes from reputable sources. We note that sometimes the negativity gets out there faster than the positives do, but as educators, we are called on to be the voice of reason, to be the voice that focuses on the scientific evidence given to us that speaks to schools can reopen in a safe manner. We note that our stakeholders have had various queries, concerns, and our intention and our plan, what we've done previously, is to respond to all of those stakeholders. But in everything that we do, if we keep at the front of our minds the students who will be impacted. And for me, as an educator of over 30 years, it is always sad that their voices may not even be heard. We don't necessarily go and ask our grade 6 students, how do you feel? We're not asking our Form 5s, how has that impacted you? Very often we hear the adults speaking, and the adult voice is important, but similarly, it is important to find out how our children are doing. And hopefully, the general public, our parents out there, know that the phase reopening is for them, is for us as well, as a nation, and that we can get that support. So as we come into schools, we ask for an orderly welcome of our students. We ask for sanitization to be at the top of our agenda. We ask for effective communication in the event there is an issue, particularly for our students who are sickly or have medical issues, for our staff as well. So we continue to say these are important elements. Do not hesitate to engage us as a team through the schools. They are your first point of call. And I must say to the general public, we do not want the comparison of schools because we know that one size does not fit all because of the size of the schools, because of the populations, because of where they're based. Things will happen slightly differently. But they've got an overview, and that is why we have individual school plans to cater to the needs of our individual students. We remain resolute that this is a phased reopening that is sanctioned by the Ministry of Health through the Office of the CMO. We also continue to say to all stakeholders, we are available to you should there be any queries, any areas of concern. But in all of this, we keep our students in the forefront. And Dr. George, I will put her on a spot a little bit. If she permits me to, she might just give me a little wink to say yes or no. But Dr. George has 2 daughters in the common entrance class. Dr. Faswa has a son in the common entrance class. We all have relatives. We all have families. Saint Lucia is a small country. We want the best for our students. We will not stand for anything less, but we will be guided by the Ministry of Health in order to do so within a safe environment. I thank you.
Thank you so much, Chief Education Officer, Dr. Meyer. And there we have it, ladies and gentlemen, parents, teachers, the union, the general community at large, all stakeholders. We've heard the message being reiterated by the officials we have here today, and of course they are integral to the process of the reopening of school for 16 days, only to seek to maximize the potential of the students who are going to write 2 key exams, and they are the common entrance examinations and CSEC examinations. They are going to be at school for only 16 days, and as has been articulated, all of the protocols concerning COVID-19 will be in place. The schools are assiduously getting ready for June 2nd. And so coming from us here at the National Television Network, the Information Command Center, we would like to thank all of the private media houses that helped us to broadcast this briefing today. We would like to thank the staff of the GIS, you, the viewers, the panel. I am Claudia Monlouis, saying goodbye.